You know, it wasn't that long ago when talk of mental health issues was only heard behind closed doors, to be honest. There are probably some people who still think that should be the case today. But the thing is, poor mental health is a social problem.
Oh yeah, it can impact many aspects of life, including relationships, work, and school, and it can have a negative impact on society as a whole. That's why last year a group came together to discuss the mental health needs of the community with the goal of creating a long-term action plan for change. That group is called Healthy Minds for Sure. And with more on this mission, please welcome Mike Dunn. He is the president and CEO of the Greater Salisbury Committee. Joining him is Dr. Samantha Scott, clinical psychologist with the Child and Family Center. Thank you both for being here this
Of course,
afternoon.
thank you very much.
Thanks for having us.
Mike, I want to start with you. The Greater Salisbury Committee spearheaded this effort.
Yeah.
What prompted that?
The Henson Foundation, which we all know, they were seeing more and more of their grant requests would have a mental and behavioral health component. So their trustees kind of hit a timeout button. They said, hey, why don't we go talk to the Greater Salisbury Committee and let's talk about it. And from that, we called Dr. Sam Scott. And so the Henson Foundation and the Greater Salisbury Committee were like, let's talk to Sam. Let's bring the right people in the room. And I've got a list of the right people. It's Salisbury University, it's Tidal Health, it's Warwick, it's the Purdue Foundation, the Community Foundation of the Eastern Shore. And our goal at a very macro level, what 3 to 5 things could we do as a community in the next, say, 3 to 5 years? And let's launch an initiative. And the initiative is called Healthy Minds for Sure. And here we are about a year or so later.
Okay, so Dr. Scott, let me ask you, how big of a need do you see around here for this?
What's the largest number you can think of?
Really?
And it's not just us, I mean, it's nationwide.
Yeah.
And people always ask, you know, since the pandemic, are we seeing a mental health crisis? And I always say, we've been in a mental health crisis, I think, for at least a decade, for sure. One of the things I think the pandemic did was to demonstrate that.
Yeah.
And I think a lot more people are taking that seriously and really looking for, as Mike mentioned with the Henson Foundation, like, how do we put our money to where the needs are greatest and improve this, especially in our community?
So how does something like this affect the community? Is it a domino effect?
Oh, sure. I mean, when we talk about mental health and behavioral health, it encompasses all aspects of life. You know, from our little ones being able to be successful in school to older adolescents and adults being successful in the community and holding jobs and being, you know, productive. But then also just emotional and psychological health and having healthy relationships and positive parenting, and it affects everything.
Yeah. Mike, do you think stigmas play into this?
Oh, stigma, no question, Jimmy. That was one of the things that we wanted to try and look at, is how can we erase the stigma. One of our partners, and we're kind of starting this effort in Wicomico County, but we want to make it Lower Shore wide. The school system and Dr. Micah Stauffer and his staff, what they see every day, and whether you're a 6th grader or a 60-year-old,
Right.
stigma is very much a part of the mental and behavioral health challenges. Got to be able to talk about it. If I had a broken or a fractured knee right now, I'd be sitting here in a cast.
Yeah.
We wouldn't think anything about it. But somehow, when it's mental and behavioral health, you know, you're
When
not
something else is
necessarily
broken.
allowed to talk about the obvious, as Dr. Scott knows way better than I do.
Wow.
Yeah.
Okay, so you've identified the problem, you've gathered the players. How do you execute all of this? What do you do?
Yeah, Sam, we started early, and we wanted to, the first thing that we did was have an awareness event at, again, the home of Jim and Jan Purdue, and they understood it, the Purdue Foundation. And from that, we launched a series of efforts, and Sam can certainly talk about them and what we've done in this opening year or so.
Sure. So when we first started, we sat down and we had a 2-3 hour long meeting of identifying all the problems. But it was a different kind of meeting. You know, we've had these committees for years here in the community, but this meeting, we set the goal of, okay, let's identify the problems, but when we leave here in the next couple of months, we need a 5-year action plan. And what are we going to do different to target our biggest needs in the community? And so from that, we really identified, we call them kind of 5 pillars of things that we want to target. One of them being recruiting and retaining clinicians here in the community, but also making sure that they are trained to handle the specific needs of our community, and some of those needs that have just morphed since COVID and over the last decade with technology, et cetera. And so that was one of our biggest things that we've decided to focus on this year. Also, just collaborative care amongst all of the different providers in the community, certainly decreasing the stigma and better access to care. So once we have what we need here, how do we make sure everyone is getting not